I think patients coming to Riverside have plenty of opportunity to, one, get established in a well-grounded system. We have excellent communication between our primary care physicians and our specialty offices. We offer the latest in techniques in cardiovascular disease. As a vascular surgeon, we work on blood vessels, whether they're narrowed or there's an aneurysm or there's various pathologies, but we help blood flow better. February being Heart Month, I think it's important to focus on cardiovascular issues, and vascular disease is part of that.
I went to urgent care in Williamsburg after about a week of not eating, bloating when I did try to eat, no appetite. He came back and he said, "You've got some significant blockage." And he said, "We have a wonderful vascular group here at Riverside. I'd like to get you an appointment very, very soon with Dr. Mohan."
When patients come to visit us, we first have to decide if they have an arterial problem or a venous problem. Depending on the issue, they could present with pain when they walk. They could have pain when they eat. They could have narrowing of arteries going up to their brain that could put them at risk for stroke. They can have aneurysms that could potentially rupture. So these are all problems that we identify and provide the appropriate treatment. Mr. Schwann came to me with belly pain after he eats. And so we did some testing and we found that he had some narrowing of the arteries that provide blood flow to his intestines.
At this point, I'm concerned about the superior mesenteric artery. Why am I? Because this is what killed my mother.
And so we did a minimally invasive procedure in the cath lab where we went into an artery in the wrist, went into the belly, and opened up the narrowed blood vessel with a stent. This allowed him to have more blood flow to his intestines and his stomach, and ultimately allowed him to eat without having pain afterward.
Dr. Mohan, the staff was wonderful, and about 2.5 hours later, he's got a stent in place in the mesenteric artery. Started gaining weight again. Magically, my appetite came back.
Every time we see a vascular patient, our visit is divided into a whole segment on prevention, getting them to understand what the disease process is, and then talking about the actual treatment portion of it. Now, the preventative aspects of it are continued throughout our relationship with the patients. The treatment only comes into play when their symptoms are very severe or such that it's life-threatening. Unfortunately, cardiovascular disease is often a silent killer. We don't know that it's there until it presents itself in a variety of ways, either a heart attack or pain with walking or a stroke or various other issues. And so the best treatment is prevention. There are several things that people can do to improve their vascular health. Overall, it's similar to things that we talk about to improve your heart health. Regular exercise, eating a diet low in fat and low in salt, avoiding smoking, and making sure that you're taking all the medications that are prescribed. I think regular doctor visits are very important when it comes to cardiovascular health. Again, because it's kind of a silent killer, we don't know whether it's progressed or not. So in vascular disease, we do regular surveillance on narrowing of the blood vessels to see how severe it is. And that way, if it's gotten to a point where it needs to be repaired, we can do that before it causes an issue. And so we want to make sure, number one, people understand the risk factors for developing vascular disease and also what they can do to prevent it. And if they have it, how to go ahead and treat it.
My advice is to anybody, listen to the little voices. If the little voices are telling you that you need to go, listen to the little voices. Dr. Mohan is a very calming person. Wasn't terrified, but I, certainly been in more pleasant circumstances, yeah. He's great. He saved my life. I mean, my mother died of this. I'm extremely grateful. I'm extremely grateful to every one of them.